Hi, thank you all very much. My name is Shannon Halbrook. I'm a fiscal analyst with Every Texan. We're an independent, nonpartisan research organization that advocates for public policy that helps Texans of all backgrounds reach their full potential. Whether we live in Amarillo or Brownsville, we're all impacted by the quality and level of services that HHSC is able to provide. For decades, the HHSC workforce has consistently faced one of the highest average turnover rates among Texas state agencies. Additionally, the state workforce faces unmanageable workloads because the average headcount has not increased in at least the last 10 years. Since 2003, the Texas population has increased by 38%, while the size of the overall state agency workforce has shrunk by 1%. It is time to raise wages across the board for HHSC's workers and adequately staff this agency's critical work. Every Texan and the Texas State Employees Union surveyed state agency workers between April and June of this year. We received 6,500 responses, of which 2,971 came from HHSC. Our survey results show that the HHSC's workforce's main concerns are low pay and understaffing. And I'll just read out a few findings from the survey real quick. From fiscal 22 to 23, average turnover at HHSC did drop from 29% to 21.5%. Yet 53% of our survey respondents still indicated understaffing has continued to be a problem during the past year. 82% indicated that their workload has increased in the past year, and 66% have considered leaving their job in the last year due to low pay and unmanageable workloads. 48% of survey respondents are concerned that heavy workloads affect their ability to provide Texas's families with quality services. And I just want to read a little bit from our survey that was provided by a disability specialist at HHSC. This is a quote from her response. "It feels as if the citizens of Texas are just numbers and not people. While we're not social workers at this agency, we still have a duty to review their claims with as much care and concern as humanly possible, while also keeping up with reasonable assignments." Lastly, 50% of survey respondents indicated that their top concern affecting their decision to leave the agency is low pay, and 71% indicated an increase in pay would convince them to stay in their jobs. As expert analysis and these survey results indicate, the HHSC workforce situation is dire. Those feeling the impact of high turnover, low pay, and unhealthy incentive-based workplaces for HHSC workers include the 2.5 million Texans disenrolled from Medicaid during the unwinding process. As processing delays and backlogs continue, the federal agencies overseeing Medicaid, CHIP, and SNAP programs, that's USDA and CMS, have suggested that the state of HHSC's workforce is a significant contributor to our state's years of inability to operate within state and federal laws and the vast number of eligible but unenrolled Texans. The unwinding period revealed long-standing systemic inaccuracies in HHSC's eligibility review processes, which include in many cases manual review from overworked, underpaid, and undertrained staff. Every Texan asks the LBB to approve HHSC's request for increased funding for pay and training for HHSC staff, and to increase utilization of computer-based household data review and renewal processes to reduce strain on the workforce. Once again, it's critical that the state legislature fully staff HHSC at an appropriate average headcount for an agency of its size and importance. Last thing, our survey responses suggest that last year's pay increases, while much appreciated, leave room for further improvement, and so every Texan will be requesting a $10,000 across-the-board pay raise for all state employees. Thank you very much for your attention.